class. I'm going to continue with this online lecture, and our concept now is reproduction and sexuality, and our exemplar is STIs, or sexually transmitted infections. So let's now review this PowerPoint that I have up for you, okay? Okay, STIs are transmitted by vaginal, oral, anal, intimate contact. And STDs typically are viruses that cannot be cured, but they can be caused by bacteria, viruses, fungi, protozoa, and parasite. And there's many consequences involved. I will say that unfortunately, they are at epidemic proportions. There's a rise in STIs, even in 2020. Women biologically are at higher risk, incidence highest in ages between 15 years of age to 24 years of age, and also in minorities. Increased activity in older adults, and there is a synergy among all STIs due to HIV and AIDS. Your book gives some very alarming data and statistics where the World Health Organization estimates that 357 million new infections of curable STIs occur worldwide each year. In the United States, an estimated 20 million new cases of STI occur each year. And STIs affect men and women of all ages, backgrounds, and socioeconomic levels. And as I said on the PowerPoint slide, of these 20 million annual new cases, half occur among those individuals between these age groups, between 15 and 24 years of age. Women have higher rates of gonorrhea, and men have higher rates of chlamydia and syphilis. And unfortunately, with STIs, they can lead to infertility and risk for acquiring and transmitting HIV. And risk factors for contracting an STI include the following criteria. Anyone who has multiple sex partners or a new sexual partner, sex with someone who has sex with one or more others, exchange of sex for money or drugs, poverty, unemployment, and low education, and young women under the age of 25 years of age, and drug or alcohol use that lowers inhibitions. And the presence of another STI such as syphilis or HSV facilitate the transmission of HIV and AIDS, and the immune suppression caused by HIV potentiates the infectious process of other STIs. So what's important to know is that people can acquire more than one STI at the same time. In fact, people that are infected with STIs are at a greater risk of being infected with HIV if they are exposed to the virus. And this is due to several factors. Genital ulcers create a portal of entry for HIV, and non-ulcerative STIs increase the concentration of cells and genital secretions that can be targets for HIV. And infections with both an STI and HIV results in increased likelihood of having HIV in genital secretions and semen. So let's talk about prevention and control. The prevention and the control of STIs are based on the principles of education, detection, an effective diagnosis and treatment of infected individuals, along with evaluation, treatment, and counseling of sex partners of infected individuals. The ability of healthcare providers to obtain an accurate sexual history is essential to prevention and control efforts. One approach to collecting accurate sexual histories is available from the CDC. And this includes the 5 Ps. So learning who the partners of an individual are, what are their sexual practices, how to protect yourself from STIs, prevention of pregnancy, and have you had a past history of STIs, okay? Obviously, the most effective prevention is avoid sexual intercourse with infected partner, which makes sense. Don't have sex. And most of these can be prevented with a latex condom use, can be transmitted during hetero or homosexual activities, non-penetrating intimate exposure, and for treatment to be effective, sexual partners of infected individual must be treated. 2 or more STIs frequently coexist, as what I explained before. So let's talk about these specific types of STIs, okay? First one I'm going to talk about is the human papilloma virus, all right? This is the most common STI in the United States, and about an estimated 79 million Americans are affected, and up to 14 million new cases are diagnosed annually. And what's interesting to know is there are about 40 types of HPV that can affect the genitals of men and women. And all this information that I'm talking to you about comes from the CDC, which is the Center for Disease Control. One form of HPV is genital warts, and that's probably the most common one that most of us know about. And these are often painless, soft, raised or flat, large or small. They can be flesh-colored bumps on the vulvovaginal area, the perineum. They can be on the penis, the urethra, the anus, the groin, or the thigh. And more important, HPV has been identified as the causative agent in many genital cancers. So more than 11,000 women develop cervical cancer each year. And other HPV-caused cancers include vulvar, vaginal, penile, anal, and oropharyngeal cancer. Remember that HPV is so common that nearly all sexual active individuals will get at least one type of HPV at some time in their lives. And most people that have genital HPV infection do not know they are infected, because most infections in women are diagnosed by abnormal Pap test. Women are at a greater risk for HPV because they have a larger mucosal surface area exposed in the genital area. And in about 90% of the cases, HPV clears with no intervention within 2 years. When it persists, you have genital warts, cervical cancer, and less often vulvar, penile, anal, and oropharyngeal cancers may occur. How is it transmitted? Because most of these people who are infected are asymptomatic, but it's transferred by vaginal, anal, or oral genital contact. And the incubation period is about 3 weeks to 3 months. Some people actually do not even have any manifestations, and others will exhibit those genital warts. And diagnosis of genital warts may be made on the basis of the clinical appearance on a physical exam. And that's why it's important that women get screened regularly by having Pap test. Those will identify those precancerous lesions on the cervix early, and treatment in the early stages will prevent cancer. There's no drug that can actually cure HPV itself, but genital warts can be removed with treatments applied by a healthcare provider or by the patient. And healthcare providers may use chiroprobes to freeze the warts, or a chemical burn with a certain type of acid. in the office setting. Patients may use other types of home remedies to remove the warts, and extensive warts may require actually CO2 laser removal. Okay, so that's HPV. All right, so hopefully that explains that a little bit more in detail. Okay, the next one we're going to talk about is chlamydia. Chlamydia is a bacterium that actually behaves like a virus. It produces only within host cells, and this bacteria is spread by sexual contact and to the neonate by passage through the birth canal of an infected mother. Chlamydia is probably the most commonly reported bacterial STI in the United States, affecting an estimated almost 3 million individuals each year. About roughly 2/3 of these new infections occur in people between the ages of 15 and 24, and an estimated 1 in 20 sexually active teenage girls has chlamydia. Risk factors for chlamydia include being sexually active, being female, and being between the ages of 14 and 19, and having a personal history of an STI, or having a partner who has also had a history of an STI, a cervical ectopy, having multiple partners, or having unprotected sex, and using drugs or alcohol that increase risky sexual behavior. Most of the time, chlamydia is asymptomatic in most women until the uterus and the fallopian tubes have been invaded, and treatment may be delayed, resulting in long-term complications. And this is where chlamydia is a common cause of preventable infertility and ectopic pregnancies. Infants born to mothers with untreated chlamydia are at risk for chlamydia conjunctivitis and also pneumonia. And untreated chlamydial infections in women may actually move up into the upper reproductive tract, causing complications such as PID, which is pelvic inflammatory disease, which may be accompanied by endometriosis and salpingitis. And chronic pelvic pain, scarring of the fallopian tubes, and systemic dissemination and septicemia may also occur. And because of the scarring of the fallopian tubes, many times this leads to ectopic pregnancies, which means the baby begins growing in the fallopian tubes and not in the uterus. And this could be a very life-threatening disorder. Complications of this of chlamydial infections in men include epididymitis and prostatitis, sterility, and reactive arthritis. And the CDC recommends routine screening for sexually active younger women than 25 to minimize these serious complications. This bacterial infection is usually treated with antibiotics. Screening and diagnostic testing usually precede treatment. However, asymptomatic individuals are often treated on a presumptive basis. And usually the drug of choice is Zithromax orally in a single day, and doxycycline, and what else? And levofloxacin usually are given orally for 7 days. And both sexual partners must be treated at the same time or prior to resuming sexual intercourse. Okay, so that's chlamydia. The next one I'm going to talk about is gonorrhea. And this is caused by Neisseria gonorrhea. It's also known as GC, or the clap. It's a gram-negative diplococcus. And gonorrhea is the second most common reportable communicable disease in the United States. And the CDC estimates that approximately 820,000 new cases occur annually, but less than half of new infections are reported each year, which is very sad. Gonorrhea rates for African Americans are usually higher than rates for non-Hispanic, and other risk factors include residence in large urban areas, being transient, early onset of sexual activity, and multiple serial or consecutive sex partners, drug use, prostitution, and a previous gonorrhea infection or concurrent STI. So they already have an STI, makes it more at risk for getting gonorrhea. This organism that causes this disease is a pyogenic, which means that it produces a lot of pus. It's a pus-producing bacteria that causes inflammation that's characterized by a purulent exudate. And humans are the only host for this particular organism. And gonorrhea is transmitted by direct heterosexual and homosexual intercourse, and during delivery as the neonate passes through an infected birth canal. And how this organism gets into the body can be through the genitourinary tract, eyes, oropharynx, anorectum, or skin. The incubation for gonorrhea is about 1 to 14 days after exposure in men and within about 10 days in women. And without treatment, this disease ultimately disseminates or spreads very widely to other organs. With women, it usually starts to target the cervix, and the male, it targets the urethra. In men, gonorrhea can cause acute painful inflammation of the prostate, epididymis, and periurethral glands, and can lead to sterility. And in women, it can cause PID, endometriosis, and metritis, and salpingitis, and pelvic peritonitis, as it says here on the slide. So here's what the manifestations look like when we're talking about gonorrhea. In men, it could cause dysuria, which is very painful urination, serous, milky, purulent penial discharge. Some men also experience regional lymphadenopathy, which means their lymph nodes are all enlarged. And many men and most women with gonorrhea remain asymptomatic until the disease becomes advanced. And women with symptoms experience, again, dysuria like men do, urinary frequency, abnormal menses. They might have a more heavier flow, or they may not have a menses at all. And they have increased vaginal discharge or dyspareunia, okay? Anorectal gonorrhea is seen most often in homosexual men, and the manifestations include pruritus, mucopurulent, rectal discharge, rectal bleeding, and pain and constipation. Gonococcal pharyngitis occurs primarily in homosexual or bisexual men or heterosexual women after oral sexual contact with an infected partner, and those manifestations kind of mimic those in which somebody might have strep throat, and that includes fever, sore throat, and enlarged lymph nodes. The sad thing about these types of diseases, especially with gonorrhea, is the complications and the permanent damage that occurs in both men and women. They can include blindness, infection of blood and joints, and increase susceptibility to and transmission of HIV. Untreated gonorrhea can lead to PID in women, which may lead to internal abscesses. They can have chronic pain, ectopic pregnancy, and infertility. In men, it can cause epididymis, mysitis and prostatitis, resulting in infertility and dysuria. And because these diseases have been around a long time, many times we see antimicrobial resistance of certain antibiotics. This can be hopefully treated successfully with Azithromax and another injection of ceftriaxone, and of course a single oral dose of, like I said, Azithromax. And they usually give these medications at the same time. And really what we'd like to teach people when they're being treated for these diseases is to abstain from any sexual contact until the infection is cured in both the patient and any of the partners that they've had. And for future infections, we really recommend a condom, particularly a latex condom, particularly for pregnant women whose partners may be infected. So that's gonorrhea. Very, very terrible type of infection. And the next one is syphilis, another very common type of STI. This one is much more of a complex systemic infection. Treponema pallidum is the organism caused by this. It's an anaerobic bacteria, and it can also affect any body tissue or organ, and it can be transmitted from any open lesion, or like what we call a canker sore, during any sexual contact. The incubation period ranges from anywhere from 12 to 90 days, averaging about 21 days. If not treated appropriately, syphilis will progress into 4 stages and ultimately can lead to blindness, paralysis, mental illness, cardiovascular damage, and even death. And syphilis, again, is one of those infections that can occur with one or more other STIs, such as HIV, AIDS, or chlamydial infections. Men who have sex with men account for about 83% of the primary and secondary syphilis cases that are reported. In addition, 458 cases of congenital syphilis were reported back in 2014. So I'm sure there's a lot more. That was like 6 years ago. So syphilis is generally characterized by 4 clinical stages: primary, secondary, latent, and tertiary. And here's what those stages look like. Okay. The first stage is that primary syphilis, where it's characterized by just the appearance of a canker sore, and might also have regional enlargement of lymph nodes. Little or no pain accompany these warning signs. But it is a time when one person is highly infectious. The canker appears at the site of inoculation, where if it's the genitals, anus, mouth, breast, or fingers, and then 3 to 4 weeks after the infectious contact. In women, a genital canker may go unnoticed, disappearing within about 3 to 6 weeks. The second stage is the secondary syphilis, and this is more systemic, with the spirochete spreading to all major organ systems. And these manifestations usually start to show up several weeks after the initial canker. And what we might see with these is a skin rash, especially on the palms of the hand or soles of the feet, and especially there are mucus patches in the oral cavity. They might develop a sore throat, lymphadenopathy, and papules on the labia, anus, or corner of the mouth. They almost feel like they have the flu. And alopecia and manifestations usually disappear within 2 to 6 weeks, and an asymptomatic latency period begins. And that's the next one, called latent, which without treatment, the secondary lesions resolve and a latent period occurs, during which time the person will start to exhibit no symptoms at all, and during the early part of this stage, sexual transmission is possible. This may last 1 year to a lifetime. And then lastly is the tertiary syphilis, and this is affects roughly about 15% of untreated individuals progress to late stage or tertiary syphilis. And there's 2 types of late-stage syphilis occur. The benign one has a rapid onset and is characterized by local development of these infiltrating tumors in the skin, the bones, and the liver, and these tumors generally respond promptly to treatment. And then you have cardiovascular syphilis, has a more insidious onset. It is a diffuse inflammatory response involving the cardiovascular system. Though disease can still be treated at this stage, much of the cardiovascular damage that's done is irreversible. It's very hard to diagnose this because it mimics many other diseases. So makes it very, very difficult, but it's a very, very serious disease as well. So those are the diseases that you are responsible for, and you can see I have them up on the screen. Again, the 4 different stages involved with syphilis. So you're responsible to know about HPV, chlamydia, gonorrhea, and syphilis. Okay, so be sure you review these this PowerPoint. We just hit on the important aspects, but there is a little bit more information that deals with these specific STIs. Students, what I have up here is the CDC website for STDs, okay, and you can see it's a very simple web address, cdc.gov/s, and d/. And it's quite a coincidence that as we talk about this, it looks like it's STD Awareness Week between April 12th to April 18th of 2020. And this is a really good website to give you further information. It can talk a lot about the diseases itself. And as you can see here, I've got the list of some of the diseases that I just got done talking to you about. Here's chlamydia. I'll bring this up. And as you can see, it talks about the fact sheet, the statistics, and the treatment, and gives you other information about these. And you can see on my left, let me put that out there, you can see where it has, if you hit any of these, you're responsible for chlamydia, gonorrhea, HPV, and right here, and HPV, and then syphilis. But you can hit each of those and it'll give you detailed information about that, and a lot of what I just told you about that came from your book as well. But it's a great website. It's from this Center for Disease Control and Prevention. And 24/7 they're out to save lives and protect people. So I wanted to just bring that to your attention, that this very, very helpful website is out there. And it's provided by the CDC, or the Center for Disease Control and Prevention. All right? So just wanted to give you that information. All right, class. I lastly would like to go over these questions related to STIs, just to evaluate some of your learning from the information that I provided you, and just to have you stop and think a little bit about these diseases. So our question 1 is, how will care of the pregnant client with genital herpes differ from the care provided to a pregnant client who does not have this infection? So think about this. Think about what we would want to do for this patient during her birthing process. Well, the pregnant client who has herpes will be watched very closely during pregnancy for any lesions or outbreaks, which makes sense. And the client will likely be delivered by C-section to prevent any possible danger to the body, to the baby. So when this is definitely diagnosed that the woman has genital herpes, they will not let this baby be born per vaginal delivery. It will be a C-section, okay? Question 2, what is your priority nursing diagnosis for the young couple contemplating pregnancy who are both diagnosed with genital warts? And that's a very good question. The priority nursing diagnosis for this couple would be alteration in skin integrity as evidenced by HPV. And what we would encourage this couple to do is to have any warts removed before getting pregnant, and the couple should avoid any sexual activity for 1 month after becoming free of the disease. So that's what we would hope would happen. So in case, the woman gets pregnant, or to make sure that the warts are removed permanently. Okay. All right. Question 3, create a plan of care addressing pain management and prevention of urinary retention for the client who's diagnosed with herpes. Okay. And so one thing that we would hope to have happen is increase fluid intake to dilute the acidic urine to cause less irritation of sensitive membranes when urinating, and respond in a timely manner to the urge when you have to urinate. Looking at your clothing. Wear a loose cotton underwear. Don't use perfumed soaps or bubble baths. Avoid sex until the sores are healed. Then use lubricant to reduce friction. And then lastly, take over-the-counter pain relief medication. And I think one of the most important aspects of this plan of care is to make sure you're increasing fluid intake to dilute that acidic acid urine, and that would be to drink a good amount of water, and that will really help quite a bit. And to avoid some of those irritants, especially on the bladder, and anything that might also be more of a dehydrating type of liquid as well. All right, question 4. What teaching will you provide the client about using sitz baths for facilitated urination when the pain of herpes causes urinary retention? And we know what a sitz bath is. It's warm water where someone sits in that to facilitate comfort when there is some problems with urinary retention or irritation. Inform the client that a sitz bath is a form of using moist, warm heat that will soothe the inflamed tissues, and teaching the client other ways to relax at the same time as using the sitz bath, such as meditation or even listening to music. Just having a very quiet and peaceful environment as well, and letting the client know that the initial flow of urine might be the most painful and that the sensitivity will decrease over time. And that's something to know. And I probably wouldn't sit in a sitz bath very long, because if there is any bacteria or any type of organism, you don't want to be sitting in that. But for a short period of time, it can bring a lot of comfort to the individual. So this pretty much concludes the part 2 of week 2, day 1 of the lecture. Please, I want to advise you to be sure that you reviewed the YouTube videos that were advised you to look at. Looking at the urinary system part 2. And then I have uploaded some handouts for you to kind of review. The ones that I just uploaded today is first types of urinary incontinence. That's in week 2 in the modules. It's probably the last 3 uploads or entries that I put into your Canvas course. But it's pretty much the information from your book about the description, pathophysiology, and the contributing factors of types of urinary incontinence. And then what else I put in there was preventing UTIs and urinary incontinence, just to provide a care plan as to what we would teach a person who is experiencing problems with urinary incontinence and for their family members. And as I said, probably the top nursing intervention for these patients is to maintain a generous fluid intake, okay? And again, clothing is essential as well. So read through that as well. And then lastly, I put in a handout that went through the lifespan, looking at the institutionalized older adult and self-care deficit, talking about functional incontinence that may be the predominant problem in any institutionalized older adult. So please look at some suggestions of what to do for these patients as well. So I put this handout in your module for week 2 as well. And there's also a handout for STIs, and again, all the PowerPoints and the questions that we went through in class are also on there for you to review as well. Okay? All right, please let me know if you have any questions on either part 1 of the online lecture, dealing with urinary incontinence, or anything with part 2 that has to do with STIs that are related to the concept of reproduction and sexuality. You're responsible to know about HPV, chlamydia, gonorrhea, and syphilis. And please, again, go to that CDC website that I showed you to review these particular infections. And please, I'm here for you all the time. I'm checking my email frequently to see if you have any questions about any of the information. Thank you so much for your attention. You guys are doing great. You're awesome. And I'm so proud of you, of your independent learning, and how well you're retaining much of this information. So keep up the great work. We're so proud of each and every one of you, how you've adapted to our new way of delivering information to you. But you're always in our thoughts, and we could not be any prouder and so happy that it's going as well as it is. So have a great day and a great weekend ahead, and I'll be in touch. Thank you for your attention.